Good evening and welcome to Healers Enlightened Network. This is webinar 128, and we are blessed tonight to have Dr. Rick Ferris with us. So tonight, before we begin things, we want to bring grace and gratitude into us. So if we can just all bow our heads for a moment and just allow that peace and that love and the gratitude flow within us. And as we allow the divine to come in and grant us what knowledge that we need to receive from Dr. Rick. And we thank you all for being here. Many blessings.
Amen.
Beautiful. We have archangels all around us, so we are very blessed. Rick, let me just start out by asking you one question. How long ago and what got you on the path that you're on now?
That's a good question. Probably take up the hour.
Short-sighted.
Started out as a pharmacist. Still did that up until recently. Then I got a PhD in clinical pharmacy. What ultimately turned me off to drugs in general, I got certified in board certified in geriatric pharmacy. And I was working with nursing homes and polypharmacy. And, you know, they're on 15 drugs, and I'd be sitting there telling the doc, well, wait a minute, you've diagnosed this patient with early Alzheimer's. 5 of these drugs have significant cognitive effects. So get them off the 5 drugs and they're going to be fine. And it was just one argument after another. And then it occurred to me, drugs are absolutely horrible. And I got a doctorate in naturopathy, and that's how I sort of got on the road to what I'm doing, certified in functional medicine. So, allopathic medicine is, and Jeff's heard this a million times, allopathic medicine is multiple specialties, symptom drug. The specialties never communicate, and they never ask the question why. And I hear this from my patients all the time. Functional medicine is kind of sort of having to know everything.
Right.
We ask the question why, and that's why my patients come to me. You know, why am I not getting better? And it's you know, and that's the big distinction. Is, you know, why do you have this particular pathology? And
Right.
you know, I've subsequently enhanced my knowledge base, certification in toxicity and detox, CBD. An area I think you would love would be iridology.
Yes, I already do.
Yeah,
I'm actually going to
certified
teach
in
a
that. That's
class.
fantastic. So,
Do you do
with
iridology, Rick?
huh?
Do you do iridology?
The camera I had stopped working, and Amy won't let me buy another one. So
They're kind of expensive.
they're very expensive, but I got all the books and everything. It's absolutely fascinating.
It is
So,
fascinating. It is.
So that's where I am today, is
Okay.
helping people figure out the why.
The big
and,
why.
And the academics behind that.
So you and I have had numerous conversations about toxicity. And today that's why we're here, because we are all full of toxins, and daily, no matter what we eat, the air we breathe, everything is toxic. So how do we, just as regular laid people, normal people that don't have background like we do, and even though if we do, how do we go about getting rid of this? If we've been doing it my age and before, we not only get it from what we're doing, but we also get it from generations back. So it's passed down through the DNA. So how do we get rid
that's
of all
called
this?
epigenetics.
Yes, epigenetics.
Well, that's a good question, and it's sort of at the end of the presentation.
Oh, okay, I'll wait. I'm sorry.
You're going to wait. So basically, I was going to start out on a positive note, but you already beat me to it. We're all toxic. Okay, so how do we know we're toxic? All right, so the list I'm going to read off, unfortunately, overlaps with many other things, but things like high or low blood pressure, okay, digestive problems, everything from SIBO to microbiome issues to diarrhea, you name it, okay? Weight loss resistant, that's a biggie. I do a lot of weight loss. And when you've addressed the estrogen dominance, and you've addressed the stress, and you've addressed the genetics, and you've addressed the hypothyroidism, okay, and you've addressed lifestyle and everything else, and you still can't budge, then you have to look at toxicity. And that's the other thing I found out after I got certified in toxicity and detox. I would always start out by looking at hormones, thyroid, the gut, stress, all of that stuff. But it occurred to me, if I don't address toxicity up front, then trying to fix anything is going to be an uphill battle. Okay. So, weight loss resistance, cognitive function, dizziness, brain fog, it's huge. Okay. Emotional, just feeling Then you've got depression, you've got anxiety, fatigue, that's huge. It's absolutely huge. Okay. Whether it's chronic fatigue, and you have to rule a lot of that out, Epstein-Barr, autoimmunity, okay, but fatigue is a huge umbrella for toxicity. Muscle pain, fibromyalgia, right? That's where all the mitochondria comes in. Yes. Joint pain, and everybody's going, well, okay, well that sounds like me, but I've got rheumatoid arthritis, and like I said, a lot of this stuff overlaps. But when you put it all together, you go, And we'll talk about testing in a minute. Temperature dysregulation, feeling cold, or not necessarily having a fever, but being hot. That's not hormonal.
Really,
insomnia.
Being cold and hot, having flashes of cold and hot's not hormonal. It's
just temperature dysregulation, insomnia. But the whole world has insomnia. Okay, literally. I don't think I have a patient that doesn't have insomnia. If I could come up with, and I created my own supplement, I did all the research and everything. It works on some people and others not. And of course, there's drugs out there that get you addicted, etc. And you become reliant on it. Hormone dysregulation. Okay, I do a ton of hormone stuff. And when we've balanced the hormones, okay, and especially women that are perimenopausal, menopausal, and things don't seem to be happening, of course, we've balanced the thyroid and everything else that impacts the hormones, then one has to do what? They've got to fall back on toxicity. And that's why I go to toxicity first. And then we begin to address the toxicity, and at the same time, we begin to address some of these other issues.
Okay, let me ask a question here, please. With people who their constitutes are very poor, they're very ill, and do we not build first before we detox?
Well, yeah, but that's part of the detox process.
Oh, okay.
Okay,
and how would you go about that? How would that look?
Well, I was going to do that last.
Okay, I keep jumping. I'm sorry.
And it's a great question, but we have to get the fundamentals behind us first. So, skin, things like eczema. Mm-hmm. Okay.
We know that's
oily skin, body odor, hair loss, things like Parkinson's, heavy metals, right? Mm-hmm. Seizures. Unexplained weight loss, and again, weight loss resistance. So there's just a myriad of symptoms associated with toxicity that unfortunately overlap with a number of other things, which is why testing ultimately becomes so important. So where do toxins come from? As you pointed out, Sin, they come from everywhere. Okay, the environment, mold, okay, glyphosate, it's huge. It's actually genetically built into our brain now. Okay. Glyphosate is one of the biggest causes of autism.
Oh, I didn't realize that.
Yeah. Very scary stuff. Very scary stuff.
Did you know that, Paulo?
The,
I didn't either. I will check that on my little guys.
Yeah, please do. Comes from cosmetics. Now, I have a list. I'm not going to read off everything. Okay, but there's about 40 ingredients in cosmetics that
Oh,
are
yes. Oh, yes.
okay. You get your nails done. What takes the polish off? Acetone.
I do not do my nails.
Okay, yeah, but everyone does, including my wife.
Yeah, a lot of people do, and it's very toxic.
Acetone is an organic solvent.
Yes.
Very toxic. Okay.
It is. But there are natural ones out there. Did you know that?
And that's what I tell my very toxic patients.
Yes. If they want their fingernails painted, there is a special one and a special remover.
And there's organic makeup.
Yes, there is organic makeup. That's what I wear, because if I wear regular makeup, I have a rash all over. So everything has to be clean. But most people don't realize that. And even when you're talking with a client and you're trying to explain to them that their makeup is toxic, you can't seem to get it across to them to get them to understand that what you're putting on your face is toxic. But if you go to the stores and talk to the people who know something, because some of the stores you go into that have beauty counter stuff, they don't know a lot, but some of them do, and they know which makeup is zero or very, very low. Let's leave the lowest footprint we can on Mother Earth.
Exactly. And I think footprint's great. And I even did a Facebook post on it, expecting to get some sort of response. And a few people kind of said, "Oh, that's a bummer." The message I left is exactly what you said, Sim, and that is, if you can find organic makeup, and the feedback, of course, when you're talking organic in general is, well, it tends to cost a little bit more, etc.
Yes, but it lasts longer. It lasts longer. It does your skin better. I mean, I don't look like, well, without makeup on, I look like I'm my age, but without makeup or with makeup on, I don't look my age. So
food's a huge.
Rick, where do we start with food? Everything we touch is pretty much toxic. The stuff they spray on it, everything that comes into our country gets radiation just to come in. It gets x-rayed. All our consumer products are full of nothing but processed foods. We don't do consumer product. We don't do boxes and cans here. We do everything homemade and fresh, or we try to. But so many people nowadays run through Mickey D's, open a box, open a can, and that's their meal. But then you stop, and you stop to look, and begging my pardon, look at all the obese children. We're creating a whole new society that is not going to be well.
Of obesity.
Yes.
And with all the inherent metabolic health related.
Yes.
It's, unfortunately, you can't ignore the socioeconomic issues here. Okay.
Right.
And there's a lot of people that are struggling to survive.
Yes, they are.
Even school systems, you look at the food that they feed these kids. Okay.
It's disgusting.
And, the families that are on Medicaid. Okay. And it's what? It's food to fill you up.
Yes. And that's it. It's not to give you brain power.
It's carbs. It's minimal protein.
Yes.
It's, at the end of the day, frankly, if you can afford it and you can eat organic, outstanding. It's just like organic makeup. If you think organic, you're going to be healthier.
Yes.
Can you get, reasonably affordable organic food? Yes, you can.
Yes. And also you can change the energy of your food by putting Reiki on it and doing Reiki to it and praying. you can change the energetic form of your food to be healthier.
Mm-hmm. So, you know, you can fish, for instance. You know, I eat, you know, anything farm raised, I don't touch.
Mm-hmm.
You know, I eat salmon. I eat a lot of salmon.
And why don't you eat anything farm raised?
Because you know, these ponds that they raise these things in, pesticides fall into them.
Oh, okay.
They actually throw hormones into these ponds.
Right.
Very scary. Okay. So yeah, I stay away from that. So food is, and again, all the preservatives.
They're awful.
I mean, just look.
In
you know,
everything.
you
And then
know,
they
it's in
change the
everything.
names, and there's 3 or 4 or 5 names for each preservative. So they get you confused and you don't even know what you're having. One thing about fish, I worked with a young lady in Hong Kong, and she eats fish 3 times a day. She started having ticks, really bad ticks. And I found the mercury poisoning in her body.
Mm-hmm.
It took almost 3 months for her ticks to stop and get that poisoning out while she was still ingesting the
Right.
meat, because that's all there was to offer.
Well, and you know, and that's the conundrum.
Yes.
Okay. When you don't have a choice, it's kind of like trying to stay ahead of the pack. Okay. You can detox. But if you continue to expose, right, the best you can do is stay ahead. I remember, and this is an interesting story. I had a guy come to me. He had and people should know this about prosthetic devices. So this guy came to me, he had a hip. And I always thought that hips, he haven't had a hip, was strictly titanium. Okay. And it's not.
No, it's not.
You got cobalt, you got beryllium, you know. So this guy was tested. So it turns out he had a severe, because he came to me and he had chronic hives. Can you imagine? Itching.
Oh, man.
So he came to me, is there anything you can do? And I said, well, so yeah, he said, I was tested and I have a sensitivity to one of the metals in my hip. And I said, look, guy, you have 2 choices. I can detox you for the rest of your life, or you're going to have to get your hip taken out. And I never heard back, but I suspect that's what he did.
Yeah.
That was kind of a no-win scenario. Okay, but it's consistent with what you're talking about. Sin is she just has nothing else to eat, fish. So all you can do is try to stay ahead of the game, right? Cleaning products.
The overuse of cleaning products right now. I mean, we need to, but we don't need to.
Well, that, and you know, without throwing out brands, it's my understanding that Melaleuca has a environmentally friendly a series of products.
And Thieves works really well for cleaning products, for your health, for immune system.
Oh yeah. Yeah.
There's so many beautiful things out there that we can use that won't leave a footprint. And
baking soda.
Oh yeah.
Incredibly
vinegar.
Healthy. Yeah, vinegar. You know, wonderful stuff. And then water. Everybody forgets about water.
Yeah.
You know, other than chlorine and fluoride.
Right.
Okay. God knows what's in it. Okay.
Right.
Most people can't afford a filtration system, but the little filters that you can get for your refrigerator now. And, you know, even if your faucet at least does something.
Yes, it does. Has anybody ever looked at water underneath of a microscope? I know you have, Rick. Has anybody ever looked at it? The first time I saw it, I was so shocked. I didn't drink water for probably a couple of weeks. I would find anything and everything else I could, even though I knew water was involved in it, but just to get my head. So it was swarming with all kinds of little pathogens and little bugs and
little paramecium and all sorts of wonderful things.
Yes, and it was disgusting. And I thought, we're really drinking this, and how are we fighting this off inside of our body if every time we take a drink, we're putting these things inside of us?
It just stresses our immune system.
Yes, it does.
So
do you think the charcoal ones are the best ones, Rick?
Charcoals are excellent. Okay, it's an excellent filtration system. Charcoal and forms of charcoal are a great detox mechanism. I use something called zeolite. Well, we'll talk about that a little bit if we have some time.
Okay.
Dental.
Oh, mercury algamines.
Unbelievable. And again, I'll tell you a personal story. I had 3 of my final mercury fillings taken out. At the time, I wasn't thinking about it too much. I had it taken out by a regular dentist instead of a biological.
Oh.
And but at the time, I was taking chlorella, which is a binder. And for some reason, I stopped taking it. About 2 or 3 weeks later, I got so sick, cognitive dysfunction. Okay, I mean, I couldn't even think. Tested myself. I had a lot of mercury. So, aggressive detox and chelation, and I got over it. But you don't know about that. Then you got root canals.
That's a whole nother program there.
Creates all sorts of toxins. Okay, different world. Okay, every tooth in your body is associated with an organ system, and most people are not aware of that. So,
And have you ever heard, Rick, that if you have a root canal, more than likely you're going to have cancer right along with it?
No.
That was a thing that was studied. Gosh, it's probably been over 20 years, so I'm sure it's not like that anymore. That I read that anytime somebody has a root canal done because of the bacteria down in here and they never get rid of the bacteria, that then causes
well, it can cause autoimmunity,
tumors growth somewhere else.
At some point we need to do another one of these on autoimmunity. Huge
thyroid
topic, huge topic these days, not just thyroid, not just Hashimoto's. Thyroid, just do one on thyroid. Okay,
we can do that.
So dental. So how do we test for this? Okay, there's a lot of very specific tests, but I start out with something called a VCS test. And I learned this in my detox program. Also, Dr. Shoemaker, who is the mold expert in the world, I went through his 11 modules, and he uses the VCS test. And whoever figured this out was brilliant. But it turns out when you start to get toxic, the first thing that goes is your inability to distinguish fine lines visually. That's pretty cool. So if you don't have any visual problems, like severe cataracts, this test is absolutely amazing. And it's about 95% effective to identify toxicity, not the type. So it'll tell me whether you're mold toxic, whether you have Lyme, whether you have Candida, whether you have heavy metal or whatever. It just won't tell me what. Whether you have biotoxins in general, everybody does, by the way.
Oh, yes.
So when you do the VCS test, it has 5 columns to it. The first 2 columns tend to be nutritionally related. I don't pay too much attention, but the final 3 are very diagnostic for toxicity. And the final column is more biotoxin. Everybody fills up on that one. And so the VCS tells me the degree of toxicity and how aggressive I have to be as I begin to detox these folks. First thing I do, it's a 15-minute visual test and tells me a lot immediately. Great place to start. After that, we do what? We go back to the symptoms. Okay.
Right.
And then I start asking about environment. I'm doing a lot with mold toxicity. Very scary stuff. It's treatable, but it's a bitch. Okay. And
Yes, it is.
so tell me where you live. As a matter of fact, I've got a girl right now who's got all sorts of emotional, physical issues. She finally tells me, I'm this hormonal stuff also. So she finally tells me, I said, I haven't asked you this question because we were dealing with everything else, but tell me about where you live. I said, any mold around? Oh, she goes, oh yeah, there's mold all over the vents in my bedroom. So,
Oh, God bless her soul.
yeah, so I'm sending her and this is how we test for it. I'm sending her a mold mycotoxin, because that's what causes the actual disease state. A test for testing for mycotoxin. Now, if it's blood related, most of the time it's covered by insurance. Okay.
Yes.
If it's not, then you get into very specific tests. Some are covered by insurance, some are not. The mold test, which if they're going to work with me, I insist on. The problem is it's $300, and that's out of your pocket. But if I don't identify the fact that you've got the mycotoxins, then trying to deal with them is just, it's just an uphill battle.
It is.
But mold's one of the tougher ones. The heavy metals, they cause, as you pointed out, sin, cause all sorts of things, especially cognitive dysfunction.
Oh,
highly associated with Parkinson's.
Yes. What about all the like the nuclear radiation, the stuff we get up out of the ground, the radon, or all the x-rays that we have to take, or the constant CTs, or all this stuff that we constantly have to take? That also puts toxins through our bodies, does it not?
Yeah, it does. And believe it or not, there's some interesting homeopathic approaches to dealing with that.
Oh, really?
Homeopathy is fascinating. I've been trained in it, but it's one of those things you either do as a practice or you don't. Okay. Right. So rather than introduce it with everything else I do, I don't. Okay. But I've got a whole book on treating radiation poisoning using homeopathy. I do
too, but every time I open it up, it's like,
yeah, like, well,
yeah, it's like going to take forever.
Essential oil. You can do amazing things with essential oils.
Yes.
But that needs to be your practice.
Right. And us girls know how to do that, don't we?
Yeah. There's no room in my practice. Okay. But it's
well, just send them to me, Rick. I'll take care of them for you.
Yeah. Yeah. There you go. There you go. Well, you don't even need to see them, which is the beauty of it. So you can test. So I start out with a VCS test.
Right.
Okay. If I'm worried about mold, I do mold. Heavy metal, I can do that. Heavy metal needs to be tested with blood, urine, and believe it or not, hair analysis. Hair analysis is pretty cool. It's easy to do. It's not expensive. It's about a $75 test. Women can't use dyed hair, though. That's a bummer. So you have to wait. Wait until some of your hair grows out, but it's a simple test to do. And it gives me a whole look at imbalances in your electrolytes as well as any heavy metals. So you really to get a good look see, but I'll run just a blood panel.
Rick, when you're this toxic, since you're dehydrated, aren't your cells dehydrated too?
Well, of course they are.
So is there a different protocol between hydrating your body and hydrating your cells?
Well, when you hydrate your body, you hydrate your cells.
It's just automatic. And then if you're not absorbing it, you're going to have to remove that.
Yeah.
Or if you're not utilizing it.
And a lot of it is geared around sodium.
Yes.
Okay. So they call it hyperosmolar, which you have too much sodium, you have too much water, right?
Right.
etc. So, hydration is, I can't even tell you. I mean,
it's so important. I drink about 10 glasses a day and I feel like I am still not.
Yeah. And you and my wife, Amy. So, and then you can test for pesticides, you can test for organic solvents, and there's any number of tests. I use a company called Genova. Genova. And except for Medicare and the military, I actually work with a provider who in fact has a portal with Medicare. And so I send my patients to her. The rest of them probably covered by insurance. There's a copay. Still not cheap, but $150 versus $300 or more. and you get a tremendous amount of information. So I can do stool tests. I can, it's just incredible.
Does anybody have any questions right now? I didn't even ask all the way through.
And
If anybody has any questions,
open it up to questions.
Please do. If anybody has any question about any toxicity that they're concerned about within their body, that they've heard about, please don't hesitate to ask. That's what we're here for.
Now, how do we detox?
You take zeolite.
Zeolite is a it's called a calyptolite, which is a form of earth. Okay. And it is, think of it as a toxic sponge. Okay. That when it runs through your gut, when toxins run through your gut, and that's how most of them are eliminated, it picks them up. Okay. Now, your primary detox protein in your body is called glutathione.
Right.
Absolutely critical. And I test for glutathione. And when I was doing genetics, I was absolutely amazed that we either couldn't make it or couldn't use it. And so if you don't replace the glutathione, and it's easy to do, either through a liposomal or acetylglutathione or acetylglutathione, which is a tablet. The liposomal is fantastic, goes up to the brain and everything, just doesn't taste so hot, but it's very effective. So I usually use just to start. Okay, if I don't know, I got to start someplace. While I'm doing my testing, I've got to start someplace. So I'll give them the zeolite powder, okay, a scoop a day, and get them on
a whole scoop.
Well, it's a tiny little spoon. A scoop of that, and I'll get them started on the glutathione. Okay. Now, the thing you have to be aware of, and I send all my patients the information ahead of time, is if you detox too quickly, then you can get something called a Herxheimer reaction. And that's where you feel worse initially before you feel better. All right. But being aware of that is important, is very important. Now, when you're dealing with heavy metals,
can you do something to offset the Herx reaction or no?
Well, first of all, you got to be aware of it. So if we're going too fast and you're feeling like caca, okay, then you have to back off a little bit. Okay. But primarily, speaking of hydration, you hydrate, because that's also going to help to do what? Get rid of the toxins.
Get rid of it.
And keep you hydrated. So that's the critical part. That's how I start right away. Okay. Making sure they understand the implications of detoxing too quickly. Now, if it's heavy metals, then it's a different story. Okay, then I've got to use chelating. Now, I still use glutathione. I still use zeolite, but now I have to use chelating agents.
Right.
Okay,
chelating agents,
right. Things like that. That actually grab the the heavy metals. And those
chelating agents, some people aren't aware of. They bind and they pull it off. Some people use like what Nature Sunshine would use a chel agent for is someone that has very high blood pressure or LDL, HDL, their cholesterol's off the wall. They would use this, but you have to build up and then stay on it for how long you muscle test for, and then you come back down and it will remove it and balance it out. And then you stay on this for however long you need to stay on it. Is that how you do that, Rick?
Well, I do it orally, but you can do it with IVs. Especially now there's a guy, he just recently passed away down here in Texas. He specialized in cancer. That was a different area, but he specialized in chelating cardiovascular issues. And the stuff that I'm going to do an aside here. Okay. Atherosclerosis is not cholesterol.
No.
It's calcium.
Yes.
It's calcium deposition. So what this guy was doing was he was chelating calcium. He was replacing serum calcium while he was removing the calcium around the arteries. And he did quite well doing that. And he would have a series of chelation injections. So for him, it was very invasive. Okay. For me, it's all oral.
Yeah, it's oral. Yeah, that's what I do, is oral for people for that.
Yeah, for me, it's all oral.
And I do it very slowly, for they don't have any problems along the way, because you can have many when you're chelating and
many issues.
Mm-hmm.
And
so if you do have a client that you're putting on chelation therapy, make sure you check with them every few days. Stay on top of them.
My clients, when I'm detoxing somebody, I have them touch base with me every day. Simply because I need to know that anytime I'm dealing with somebody that's come to me that's a mess, okay, and I give them a plan. They're usually a mess. I give them a plan, and I say, look, as you start this plan, I need feedback on a routine basis.
Mm-hmm.
So if we're going to fine tune, then we're going to fine tune.
Right.
Even hormones. Okay, get started on hormones. Let me know how you're doing. It takes a little while for them to stabilize, but
yes, it does.
Yeah, you have to let me know.
Well, if it wouldn't have been for you, we'd have never got my thyroid stabilized.
No,
the doctor wasn't going to do it.
Well, no, because they don't know.
No,
they're not educated that way. I mean, let's face it, docs are bright people. Okay, they go to med school. You can't be idiots, but they're educated, in such a way that they can't think outside the box.
No, they've been taught to stay inside the color lines.
Yeah.
Or they will get in trouble for not staying in those colored lines.
Yeah, and what
I've seen that before too.
Oh yeah. And what you do and naturopaths do and functional medicine clinicians, even homeopathics, it's very different.
It is for each one.
For each one and thinking outside the box. So.
Mm-hmm. But we need to start thinking outside the box. Do you not believe that? To get our health back where it should have been in the first place.
Patients, what I love about the patients that come to me is they figured out that, wait a minute, I've got 5 physicians. I had a guy come to me, 5 docs, 3 autoimmune diseases. He had Hashimoto's, thyroid antibodies, and Graves' disease, which is too much thyroid.
Right.
So his endocrinologist put him on a drug called methimazole, which started to fry his kidneys.
Yeah, I bet it did. Quicker than quick.
And then so he ended up with a nephrologist, and he was this close to going on dialysis. And I said, it's the methimazole that's doing this. You need to go back to your endocrinologist and tell her that, and they never communicate. So it's that kind of thing that is so frustrating with allopathic medicine. And that's why people come to me, and we were able to fire 2 of his docs, pretty much 3 of them. So we hung on he had a rheumatologist, a gastroenterologist. I mean, this poor guy was going crazy.
Well, I believe people just are not aware of just how toxic their bodies actually are when they think it's something else. And it's actually the toxins that are making them feel this way and acting this way.
Well, let me give you a perfect example. When I get to talking about people's guts, okay, the first thing we go over the diet, and the first thing I tell them is, look, you've got GERD, you've got reflux, okay, you've got either chronic diarrhea or chronic constipation. With women, it's usually chronic constipation.
Because they worry too much.
Well, believe it or not, it has a lot to do with the vagus nerve.
Yes.
But also and it's very cultural, by the way.
Yes.
Which I thought was fascinating when somebody actually told me that.
Yes. It's amazing what's all tied into each and every one of our heritages.
Oh, it's phenomenal. But the first thing I tell people to do is you have to start doing the paleo diet. Now, the paleo diet is somewhat restricted, but not really. Can't do sugar. Okay, so what I tell people, oh God, I need my sugar. 70% chocolate. Okay, it's incredibly healthy, takes the edge off your sweet tooth. Okay, dairy, I can live with dairy. It's the carbs. You gotta be gluten free. I can tell you gluten stories. I can tell you miracle stories around gluten. But here's what I tell my folks. I said, do me a favor religiously, go gluten free for 30 days and then eat gluten and call me. And inevitably they go, oh my God, I felt this bad for all those years.
Yes, I've done this to several
gluten
too.
again? No,
yes.
I'm not. Thank you very much.
Man.
Now there's a ton of gluten-free food out there.
But is it really gluten-free?
Well, you have to assume it is. Okay, if it has GF, you have to assume it's gluten-free. I mean, otherwise you'll go nuts. Okay, because then you'll eat nothing. All right.
Yeah.
So I had a phenomenal gluten-free pizza last night. Okay, it was great. Schwann's, by the way, has one of the best gluten-free pizzas. So and it's not that much more expensive, and there's tons. Walmart has gluten-free food. The gut. Every disease state starts in the gut.
Yes.
There's a brain-gut connection. Most people don't realize it.
Right.
The gut is beat to death by toxicity.
Yes.
And just one note on mold. And I tell my people right up front, if you don't get out of the mold environment, there's nothing I can do for you.
Now, you're talking about inside mold. What if it's outside of your house and you're in the forest and it's growing up your trees?
Well, that's different, you know.
Okay.
If you're living in the forest, then you got a problem. Okay. But I'm talking about even in an office environment. Okay?
Oh yeah, you can walk into homes. Has everybody ever walked into a home or into a house and smelled the mold?
You can smell it.
And I turn around and walk out. I can't breathe it.
Sick.
Yeah,
and
I can't breathe it.
I belong to a Facebook mold site.
I didn't even know there was a Facebook mold site.
No, it's tragic. Because what happens? Yeah. Oh, yeah. No, there's a site for just about everything you can imagine.
I'll have to look at the Facebook mold site. I did not realize that. All y'all did that. Lisa, you do that.
Endometriosis, all sorts of sites. But the tragedy is, and these people, they're in a home that's filled with mold. They're sick. They come to me or somebody else that does this. And the first thing they say is you got to get out. You have to do one of two things. You have to get rid of the mold in your house and the mycotoxins. Costs a ton of money.
Yes.
First they have it tested, then you got to get rid of it, or you move.
Yes.
You're screwed.
Either way.
I mean, you're screwed, and I can't do anything for you. Now, I did have a family where it was the young kid that seemed to be taking the hit. They actually rented an RV, and that's where the kid lived. And and they were trying to come up with the money to just get out of the house. But the problem is you can't sell a house, right?
Yeah.
Who's going to buy it?
Like that?
Nobody wants it.
No.
Or you spend the money to get it taken care of.
So since we have toxins clear back from our DNA that gets transferred to us, when we're born, we're already toxic because we're not fully developed in every area. So we're already toxic from.
There is the maternal stuff. Okay. I mean, you would pick that stuff up, and you do. Okay. I wouldn't be looking for it, but you can pick it up. Sin. There is maternal transfer, placental transfer. Not a lot, but there is. but the whole concept of epigenetics is pretty scary.
Yes,
and that's where, in the last few generations, what we've done to ourselves is appalling. Okay. And epigenetics, we used to think it went back millennia. Okay, that's not the case anymore. Mm-hmm. So if we're routinely exposed to a toxin, what happens is it changes the way our chromosomes present. It doesn't actually change the structure of the chromosome, but it changes the way they present. That's called epigenetics. And what do you think happens? It's passed on, and then it's passed on.
Right. And then there's links that are left out because it doesn't recopy because of the toxins. And there's ones that I just read an article the other day about, they have now come up with the use of talons. And I don't remember how the whole name is, but I'm sure you've heard of it, where they go in and they cut the genes and put a fake gene in, and it's reciprocated and regrows and causes the others to grow. The trouble is that when they cut that gene with these talons to put the other gene in, it erases some of the other ones. So you're erasing information. So I don't understand how they can go forward with this project. They're going to try to use it on cancer patients to cut the epigenetics to be able to apply the new cells.
That, but anytime it's a new science. It's a new science.
Yeah.
An exciting science. Because if it can do what
they think it can do, it'd be amazing.
Pretty amazing.
Too bad they didn't listen to Dr. Rife all those years ago and just allow his machine to do what it does. But now we have a miniature machine of that called the AO machine. But Barb's daughter has an immense machine and does immense things with her AO scanner. And it probably
the
takes
one you were telling me about, when I can afford it, I'm going to get it, because it's
amazing. It can tell you so many things.
It's wonderfully done.
Added new reports to it, and it gets right down to, what you've had, what you are, what's acute, what's not acute, what's chronic. When I first got it, I got it just for me because of my health issues. But
no, it's pretty good. So basically, that's kind of what I wanted to talk about in terms of toxicity. Symptoms, where it comes from, how to test for it, and ultimately how to treat it.
Right.
It's a complex process.
It is. And believe me, I got this from Dr. Rick, and I also got an orange one that I keep in the refrigerator. The thing is, the other day, I must have been taking too much, and I went down super hard for almost 4 days, and it was nothing but a fog, and I couldn't move. All I could do was sleep. So I backed off.
And that's a Hertz reaction.
Yes.
That's a Hertz reaction.
And I knew it was, so I knew to push fluids, but I couldn't even push fluids. I couldn't move. Oh. Literally I was just like froze in space. It's like, okay, what now? So I just backed off.
If anybody has any questions, please feel free. And feel free to contact me external of this presentation.
Please.
If
Jeff, you have any questions? You've already heard it.
Me?
Yes.
Jeff. No, I mean, I've been talking to Rick for what, 12 years now, or 10 years now, Rick?
Oh, has it been that long?
Oh, yeah.
Oh, it has been. Yeah.
Wow. Yeah.
Ladies, do you actually, I met him accidentally, actually. I went with my cousin to go, because she was doing the HCG diet, and I went with her. He was right around the corner, and we started talking, and I got interested in it, and he actually worked with me on that, because I was, 326 pounds at the time. Mm-hmm. And we did that a few times, and then Rick started working with me with my Hashimoto's, and helped me big time with that. And I mean,
Jeff was my poster boy.
Yeah.
Poster boy. Jeff, you are a poster boy.
He did HCG 3 times, lost 50 pounds each time.
About 40 to 42 pounds each time, Rick.
I mean, it was pretty extraordinary.
Yeah.
Okay.
Yeah,
I mean,
I would have
before and
never,
after-
Jeff, seeing you. This is the first time I've seen you since
Right.
I met you all
2009 at FIG.
those years ago, and I would have never recognized you. If we would have
So-
met in
You
Dallas,
the same
I
way
would
that
never,
you
I
were.
would have recognized your
You were a
voice.
completely different person. You lost a half a person.
Yeah, I
You know,
did.
you,
I did.
Yes.
I was really, really sick.
Yeah. Yeah. So he was, Jeff did an incredible job. He committed. I don't do too much. I still do a lot of weight stuff because my background in certified
And most
know,
of weight is
in
toxins.
nutrition. But the first place you go is lifestyle.
Lifestyle.
And
Do you teach people, Rick, besides if they don't want to do that diet, do you teach them another way to eat if they don't want to do the paleo diet?
well, there's so many diets out there. Okay.
What
Well,
if
you know,
they just ate the natural greens that God put on our earth for us to inhabit and get well from, and our own fruits, vegetables, and lean meat, and cooked it
well,
right?
I mean, sin, that's exactly right.
No carbs,
No carbs, no sugar.
no
I
sugar.
mean, sugar is the worst thing in the world we can
Yes.
possibly eat. It causes cancer. It causes inflammation. Inflammation causes everything on the face of the earth,
Yes.
literally.
Oh, you're so very welcome. God bless you. Anytime.
I didn't want to
Oh.
interrupt. I'll
Oh,
talk
it's
to you
all right,
tomorrow, Cynthia.
Please do. Do you have any questions, Amanda?
Not right now. It was very informative. It was a lot of good information, and thank you for letting me join in.
Oh, you're so very welcome.
Son
That's our
says he has
pleasure.
a question, but he wasn't listening, so he's not sure. I have to
We
get
can
him
ask
to
a
bed.
question. You might not know the
All right.
answer.
Right. All right. Thank you so much.
You're so welcome.
All right. Bye-bye.
Sid,
Yes, Jeff.
one thing I've been doing, I've been working with Rick on this. I've been doing intermittent fasting. I do that. I try to do it twice a week, from dinner to dinner the next day. And I mean, I'm about 218 right now, 218, 219, somewhere
Yes,
around
zeolite
there.
is a day.
Yeah. So, I mean, that's been very, very helpful.
Yeah, intermittent fasting actually is a great approach. It's all about glucose, by the way. Glucose plays a huge role in inflammation and just about everything else.
Yes. Barb wanted to know if zeolite is daily, and it is daily. This big, huge jug you get lasts what, 6 months?
At least, if not longer.
And I just started out with like a half a teaspoon.
You have to assume it comes with a little spoon, which is not a lot. It's not a lot, but you have to assume you're going to be exposed to toxins every single day. So I plan on detoxing using zeolite and glutathione for the rest of my life. I throw in some chlorella because I eat a lot of fish, but you've literally got to detox on a routine basis. I mean, just filling your car up with gas. If you can smell it, you're breathing it in. Organic solvents, gasoline products. So detoxing every day just makes a ton of sense. And it's not an expensive thing to do.
No. When you talk about gasoline, when we were kids on the farm, I loved gasoline. I thought it was the greatest doggone smell.
Oh, I used to love the smell.
Even
Now-
sitting, even being, we had open tractors back when we did farming, and I would plop my butt. The anhydrous tanks would be behind us, and I'd plop my butt right there and be sprayed. Grandpa used to take us underneath of it thinking it was funny as heck. Well, now I'm finding out it's not so doggone funny, because every single one of us grandkids are all ill.
So I think if Sin and I leave you with something, it's detox for life.
Yes. I have been doing it for so long, and Some days so frustrating because I do what Jeff does. I do intermittent, except I do it every day. I stop eating at 6 o'clock unless I have to have my yogurt sometimes, but I don't eat again until 11 o'clock the next day. And I probably shouldn't be doing it every day with my health as it is, right? But I feel better because I don't feel as sluggish. Whoops, just a minute, Barb.
Well, that's a good question.
How long does it take for strong medication use in ICU to be released? From what Barb is asking this, from what I have learned
See, now you're getting into something called pharmacokinetics. Okay?
Right. But from what I have learned, Barb, it takes a month for every year you have been on this medication for it to dissolve out of your tissues, your fat cells, muscles. Because remember, when we have medications, they just don't go to that area. They flood our bodies with nothing but. I mean, I know they have their place. I don't want to say that because they do, but they also overprescribe. And in the ICU, how do we know what we're getting? When I was in the ICU, it was insane, Barb. It was insane. And I was in and out. And Dave came in when I was out, rubbed my chest to wake me up because they told us I was going to die. You were on a vent for 12 days. Oh my God, have mercy. Barb, wow. I'm glad you're here.
Wow, that's a blessing. No, I mean, I can fall back into the pharmacokinetics and talk about fat solubility and everything else. And how long it stays in your body and half-life and all that other stuff.
It takes a long time, Rick, doesn't it?
I think here's a perfect example. Vitamin D is very fat soluble.
Yes.
Okay. Obese people have very low serum D levels when I test them. And it's because all the vitamin D is hanging around in the fat.
Yes.
And it's not being taken advantage of.
Yes.
From a health perspective.
Right. Hey, Rick, you remember when I lost all the weight and like my allergies started disappearing?
Yeah.
And you told me because a lot of the stuff was hanging in the fat and wasn't leaving my body until I started losing the fat on the HCG. And my allergies actually got a lot calmer.
They got a lot calmer, but probably got worse to begin with. Now, that's a really good point, Jeff. I'm working with an HCG patient right now. And what I told her right up front was, you have to detox while you're losing weight. Why? Yes. Because of the reasons we just discussed. Toxins hang out in your fat.
Yes.
So as you're beginning to lose weight, all these toxins are getting dumped into your bloodstream.
Yep.
So you got to grab them, zeolite, right?
Right.
And glutathione.
Right.
And it's critical. So I've got her on that protocol. She just started it, and we'll see.
Barb has a question for you, Rick. How well does the keto diet do compared to the paleo?
They're basically the same. The difference is, paleo, you can do a lot of oil, okay? Where keto is more fat-based. And oil is a fat, all right? I do allow some paleo folks to do gluten-free things like rice. I discourage potatoes, all right? But basically, they're both keto.
Right.
Because they're high protein, right? Veggies.
No, well, should muscle test. Lisa would like to know, she heard that some zeolite can pull and then start causing the heavy metals to attach again before they get removed. So do you have to be careful which one you're using? Which kind of zeolite you're using?
That's why I use tenoptolite, which is that zeolite, right?
Let me get to the camera.
And that's a great question.
Can you read it? It is great. I stir it in with my hot tea in the morning time. It's gone. It's done. It's over with for the day. Don't even sweat about it. But if you do too much, Believe you me, it's going to put you on your butt.
It's a sponge. Think of it as a sponge.
Yes. And I did notice that when I tried to do heavy metal detoxes before, and when I've done them, the stomach cramps are insane. You can buy it from Rick. Just send Rick a note.
Bentonite clay is another one.
Yes, bentonite clay is another one. I have that in the refrigerator. It tastes terrible, Rick. God have mercy, that stuff tastes terrible.
There is absolutely no taste, literally no taste to zeolite. Cholestyramine, which Dr. Shoemaker uses. He claims it's better than zeolite. I don't necessarily agree. It's expensive, and
find Rick's information. Rick, can I give them your phone number to for they can contact you to get the zeolite?
Yes, please. It's actually, let me give you Amy's. It's 940 372
swoop
4596.
4596. And this is Amy Ferris, his wife.
Yeah, she'll send you a book. She'll send you the book.
She'll send you two. And they're awesome. And she's really sweet to work with. And her and Dr. Rick are just so kind. They have, Jeff introduced me to Rick when my thyroid quit. After all this lung surgery and all this, my body has just been going through hell, excuse me, for some time. And Jeff so kindly introduced me to Rick. My doctor could not tell me what the crap was going on and wouldn't do anything. Rick knew just like that, just by me speaking with him, not even seeing me. And he goes, we're going to do this, 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 this. I said, okay. I took it into my doctor because I had to run everything by my doctor because Rick's not in my state, right? Well, he didn't want to do that. We fought with him for 2 months before he would let me start Cytomel. And I was all the way down. I had quit seeing clients and everything because I couldn't get up. I mean, I would decorate my face for the webinars and then I'd go back to bed. And that was that.
Thyroid's a fun one to talk about. We should.
Yes, I cannot wait until we do that.
We should do a thyroid.
You could spend the whole hour just telling stories about what we did with my thyroid.
Yes.
Yeah. And Jeff, you could tell the story.
Yeah, Jeffy. Whoops.
Yeah. My practice is a little different. People think I'm crazy.
You're not crazy, Rick.
No. First of all, everyone's got my cell number.
Yeah.
I mean, all my patients have my cell number.
And they call you at any time.
And they call me anytime. Okay. To me, that's important. So it's communication's critical.
Yeah.
They'll go to me, I have an issue. I try to make an appointment with my doctor. And even if I talk to him, it's going to cost me. Mm-hmm. So it's a real lose-lose scenario. Okay. I do functional medicine because I love it.
Right. And that's the way I feel. I give people my phone number. I know Paulo does too. We get phone calls at all times. And I think I'm going to stop doing that because you're not getting our rest. They're good. I'll occasionally get a 9 o'clock phone call, but it's usually a crisis scenario. Mm-hmm. Crises are a different story.
That's a different story.
But if you can make an appointment during the day, they should.
And I'll go, oh boy, I need to answer this one.
Do you even give yourself a break on Saturday and Sunday, Rick?
No.
Yeah, no.
No. I did 3
thank you
yesterday. So anyway, that's my thoughts on toxicity. Feel free to reach out.
Thank you so very much, Rick, for being with us today. And I cannot wait till you come on and talk about the thyroid issues. Oh, lordy.
We also need to talk about autoimmunity.
Okay, we can plan that.
Oh, there's over 100 autoimmune diseases.
Oh, there is, and they're stacking them on quicker than anything
and
because
they can't them on left.
Yeah,
right.
They can't figure out what's wrong. Oh, it has to be autoimmune, and just shove it away. Give you gabapentin, give you Lyrica. Well, that doesn't work.
Well, those don't, and they're horrible.
Yes.
and they're absolutely
horrible
horrible.
drugs,
And there's
but-
wonderful natural interventions for the most part.
Yes, there is. There's natural interventions for everything, and with
I
intention,
spent a lot
we
of
can
time
do
getting
anything.
people off drugs, including the autoimmune drugs, the TNF
Yes.
inhibitors, things like that, because of the side effect profiles are just horrific.
Oh, they're awful.
Humira, things like that. So,
Oh,
so anyway, there's in the future, there's some fun stuff we can chat about.
yes, there is. Thank you.
All right. Well, thank you, Sin. Appreciate
Well,
it.
you're welcome, Rick. Thanks for being here. Does everyone just bow their head and let's just give praise? God and Father, we thank you so very much for being present with us tonight. We bless you and we bless Rick for being here and giving us his expertise. We ask that you give each one of us the knowledge to absorb everything Rick has said and allow us to move forward to help our clients in need with your guidance and your love. In your holy name, amen.
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 Bye.
God bless you all. Bye. I'll see you soon. Paula, may I talk to you for just a moment? God bless you. Bye, everybody.